Annyeonghaseyo and greetings, ninth graders. Welcome to Coronavirus Part 3. To start with, for our entrance task, I want you to look at a graph that I'm sure all of you have seen before. Open up a Google Doc, and on that Google Doc, write about 5 to 8 sentences about what this graph means. Go ahead, hit pause on recording, write up what the graph means, and when you're finished, send it to me through Schoology. This will be your homework. So let's go over our objectives for today. So our content objective is that you should be able to understand how the coronavirus disproportionately affects the most vulnerable populations. And for your language objective is you should be able to explain how the coronavirus disproportionately affects the most vulnerable populations. Our keywords are going to be disproportionately, which means unequally. Mortality rate, another term for that is death rate. Respiratory, which means dealing with breathing in your lungs. Asthma, which is a respiratory dysfunction where you basically have trouble breathing. And then finally, redlining. Redlining is an issue that's going to come back again and again and again when we talk about unequal outcomes. So before spring break, there were lots of people talking about the coronavirus. People were unsure about what was happening. People didn't know if school was going to get canceled. Some students even started spreading a rumor that coronavirus was circulating around the Johnson Parkway apartments. And even, Donald Trump was part of all of this noise. He was talking about how the coronavirus is like the flu. It's not really anything to worry about at all. And in some ways, the coronavirus is like the flu. It's caused by a virus, and the flu can be deadly. However, in some very important ways, the coronavirus is completely different than the flu. To begin with, it's at least 10 times more deadly. So with the flu, it has a mortality rate of maybe 0.1%, and the coronavirus has a mortality rate of maybe 1 to 3%. And so if there are 1,000 people that get the flu, one person will die. If 1,000 people get the coronavirus, about 10 people and maybe even up to 30 people are going to die from it. And as I mentioned yesterday, this death rate, this mortality rate, it kind of varies depending on the age. So very young children can be affected negatively by it, and also very old people, specifically very old people, are affected negatively by the coronavirus, and their death rate is much higher. So this death rate of 1 to 3% is kind of the average death rate for people of a variety of ages. But the older you get, the more in danger you are from the coronavirus. Okay, now I'd like to do a critical thinking exercise that's related to the mortality rate of the coronavirus. But in order to do this exercise, we need some background information about coronavirus testing in the United States. Now, the United States decided for whatever reason that it was not going to use the same test the rest of the world was using for the coronavirus. This resulted in a lot of delays and setbacks for testing. As a result, the US only tested 5 people per million citizens. And we can look at a chart here which sort of explains this a little bit better. So as of March 8th, and at this time, there were lots of people dying in Seattle from the coronavirus. However, the United States barely conducted any tests. They only conducted 5 tests per million people, compared to a country like South Korea, who performed 3,692 tests per million of citizens. So anyways, the test numbers were extremely low, but what they were finding in Seattle was that the mortality rate of the coronavirus had rocketed up to almost 30%, which is absolutely terrifying. However, most people said these numbers were not very reliable, and that was because of testing. So my question to you is, how is the mortality rate from the coronavirus and testing related? So let's talk a little bit more about testing. And just to note, I don't necessarily want you to take notes every word for word that's posted here on the slide. I just put these explanations up there for you to help you understand. Just take down whatever notes help you understand the points that I'm trying to make in this slide. I don't want you to spend I don't know, 15 minutes trying to take down notes from this particular slide. Anyways, testing is one of the most important ways to track and prevent the spread of the coronavirus. As mentioned before, the US decided to go with a different type of testing protocol, and so that was a huge setback that put them behind the rest of the world in terms of testing their citizens. Tests were sent to a small number of labs, and actually the first tests were faulty. They didn't work. After that, they realized they didn't have enough tests, and also if you are not hospitalized, you cannot get tested. And so I think I mentioned to you yesterday that one of my neighbors, the woman who lives across the street from me, she got very sick. She thought that she had the coronavirus. She went to the hospital and she said that unless she needs to get hospitalized, they weren't going to test her. So she was sure that she had the coronavirus, but because there were so few tests, they were saving those few tests for people that absolutely had to have them, who were like needed immediate medical attention. Those are the people who were getting tests. So because other people aren't getting tests, it's very difficult to find out exactly what is happening with the coronavirus in the United States. Another issue with the coronavirus is supplies. So there's a dangerous shortage of supplies for doctors, nurses, hospital workers. So things like masks, personal protective equipment, as I mentioned before, tests. There are not enough tests, and even there's not enough equipment for the tests. There's specific types of syringes and wipes that you need to perform the tests. They don't have enough of those. Even things like bleach wipes, hospital cleaning equipment, they don't have enough of it. And finally, yeah, hand sanitizer would be another thing that people don't have enough of. The situation's gotten so dire that lots of medical professionals are making their own personal protective equipment. In this picture, you can see a woman has a kind of a clear folder notebook page protector as her face mask, because there's not enough face masks for medical professionals. Medical professionals are really in fear of their lives because they have to deal with coronavirus patients every day, but they don't have the equipment that they need to protect themselves. One of the medical professionals said you can't expect a firefighter to put out a fire with a spray bottle. You can't expect medical professionals to treat the coronavirus when they don't have the basic supplies that they need to keep their hospitals clean and to keep their doctors and nurses safe. So let's talk about who is being impacted by the coronavirus. The coronavirus disproportionately impacts the elderly, as I mentioned before. It also targets people who have respiratory or breathing problems. And when we think about breathing problems, there is an extremely close correlation between breathing problems and air pollution. And when we talk about air pollution, in which people live in the most polluted areas in the United States, those people are overwhelmingly people of color. So people of color have more respiratory problems. They're more vulnerable to the coronavirus. Historically, black people are 3 times more likely to die of asthma, and this number goes up to 10 times more likely to die of asthma when we talk about black children. And then finally, people without health insurance are also very vulnerable. So if you don't have good health insurance, recently I read a headline about someone who went to the hospital for treatment of the coronavirus, but this person didn't have health insurance. So they sent him away. They said, we can't treat you because you can't pay for it. And that person died. So anyways, health insurance is another factor that's going to be involved in who gets treatment and who does not. So we can see how some of these inequalities play out when we look at, for example, a place like Milwaukee, Wisconsin. In Milwaukee, Wisconsin, as of last week, every single person that died of the coronavirus was black. And this is very much related to redlining. It's very much related to the fact that even today, Milwaukee, Wisconsin is one of the most segregated cities in the United States. Non-white people have poor access to health care. There are few hospitals in red line neighborhoods, and those hospitals that do exist there, they are often undersupplied and underfunded. And so this brings up the critical question of who will get the best supplies and treatment for the coronavirus. And I think it's kind of naive to think that everyone who gets sick is going to be treated equally here in the United States. So the coronavirus is going to affect people in a very unequal way. And when I say that's going to affect people in an unequal way, it's going to kill people in an unequal way. And the coronavirus is going to cause a lot of direct and indirect deaths. So because coronavirus is expanding exponentially, it's going to end up flooding hospitals with patients. And because hospitals have a limited number of rooms, a limited number of doctors, a limited number of nurses, a limited number of ventilators, cleaning supplies, protective equipment, because all those numbers are limited, then they're going to have to make tough choices about who is allowed into the hospital and who gets treatment, especially in respect to, for example, a ventilator. Doctors may have to choose whether a patient does or does not get a ventilator, and that choice in and of itself will be a life and death decision in many cases. I'm hearing stories about these types of decisions being made in New York City right now. I've heard stories about it happening in Spain and Italy as well. So Governor Tim Walz, he estimated that there were going to be 74,000 deaths in Minnesota if there was no social distancing. And maybe just a day ago, Trump said that in the best case scenario, under the best circumstances, there was going to be possibly 100,000 deaths in the U.S. from the coronavirus, which is just a tremendously large number. If you put all the deaths from the Korean War and the Vietnam War together, that's still not the same as 100,000. 100,000 deaths is about the same as the number of soldiers that died in World War I, one of the bloodiest wars America's ever fought in. And these number of deaths are very much related to that graph that I showed you at the beginning of class. So if we take a look at this graph and I draw a line, and I'm sorry because I'm drawing this with a mouse and it doesn't really make the best line, but you get the picture. We draw a line across here. This is the healthcare system capacity. That means like how many people can get treated by our healthcare system. So if we can slow down this sort of explosive growth, we still have the same number of people going in the hospital, but they just go to the hospital over a longer time. And what that does is it allows the rooms to not fill up as much. It allows ventilators to be used on multiple people rather than not having enough ventilators for the people that are in the hospital. So they're trying to, what they say is flatten the curve so that more people can get treatment for the coronavirus and in turn less people can die. So another outcome of these flooded hospitals is going to be indirect death, because in addition to people who are sick from the coronavirus, there are going to be people who are sick from other things. And those people who are sick from other things might not find space in a hospital because everyone's getting treated for the coronavirus. They may not be able to get treatment because everyone else is getting treatment for the coronavirus. People with pre-existing respiratory conditions, they're more vulnerable to the coronavirus, but maybe they'll need a respirator too. But those respirators or ventilators, I should say, they're all being used on coronavirus patients, and so they're out of luck. So coronavirus is not only going to kill people directly by making them sick, it's going to kill people indirectly because there are not going to be enough doctors and nurses to provide care for people who are sick with other things. So the mortality rate of the coronavirus is directly related to social distancing. So by reducing the number of people that we come into contact with, we can reduce the spread of the coronavirus. So they've closed down schools, they've closed down public gatherings, so like concerts, performances, NBA, canceled. Baseball canceled. Pretty much every sporting event has been canceled. Soccer canceled. And they've also closed businesses, restaurants, any places that are non-essential. And hopefully this will help limit the spread of the coronavirus in order to reduce the explosive growth, the exponential growth of the coronavirus. Here in this graph, it's pretty interesting. You can see two different graphs, one red and one blue, and they both show 100 million people being infected by the coronavirus. But if we can spread that infection rate out over a longer time until January of 2021, then there are going to be a lot less deaths. If the infection rate spikes in July, then there are going to be a lot more deaths from the coronavirus. So social distancing is crucial to defend against the coronavirus. So my apologies. My goal is to make these presentations under 15 minutes, and we're just a little bit over that mark. However, we only have a couple more slides left, so hopefully we can muscle through this. What I'd like to talk about now is what's perhaps a silver lining to our dark coronavirus cloud. Because of social distancing, because so many places are on lockdown, people are not driving their cars, factories have closed down, and there is significantly less pollution in areas with lockdown orders. So if we look at the Midwest, we can see as of January 20th, this is a pollution map. This is what emissions are looking like throughout the Midwest, and as of March, we can see that they've diminished significantly. We see this hotspot here, which is Chicago. We can see that's completely gone. We can see another hotspot here where we're at, Minneapolis, and that's diminished significantly as well. If we look towards the west coast of the United States, we can see a similar decline in pollution, and this is happening not only in the United States, but in places like New Delhi, India. We can see just the dramatic change that's happened when people have stopped driving their cars and factories have closed down temporarily. I'll go ahead and show you one more image before we finish. And this is a pollution map of China, an emissions map of China, and we can see that there's a dramatic change that happened because people weren't going out because of the coronavirus. Now let's go ahead and just touch base about homework. Your homework is your entrance task. I asked you that question about the two different graphs for coronavirus growth. And next, I had a critical thinking question. I would like you to go ahead and post a response to that question in Schoology. If you have any questions, please send me an email, sjkwok@sejongacademy.org, or you can come visit me during office hours every day, 9:30 to 10:30 a.m. Okay, thank you, and I will see you next time. Peace.